Hi, Mr. Banner. We're going to move on to the neck. Have you noticed any pain or swelling in your neck? Okay. I'm now going to palpate lymph nodes. We're going to begin with pre-auricular, posterior auricular, occipital, submandibular, submental, sublingual, and supraclavicular. I'm then going to assess the neck to assure that the trachea is midline. Mr. Banner, I'm now going to assess your respiratory system. Do you have any problems breathing? Do you have any shortness of breath? Do you have a cough? Is your cough productive? What is the color of the sputum? Is there any odor? Tell me about your smoking habits. Okay, I'm now going to inspect the chest for shape and symmetry, and then I will listen to lung sounds. When I'm listening for lung sounds, I'm going to assess the rate, rhythm, and quality, not listening over any bones. I'm going to listen above the clavicle, 10 areas on the front, 20 areas on the back, and 3 to 4 on each side bilaterally with the patient's hands over their head. I'm going to clean my equipment before I use it on my client. For demonstration purposes, I'm going to use our skeleton to show you where you need to listen for lung sounds. You do not want to listen over bones, but in the intercostal spaces. Have your client take a deep breath in, out, in, and out as you assess lung sounds. Ask your client to raise their arm above their head. Continue breathing. Assess the other side. Twenty areas on the back. Breathe in and out. As you're assessing lung sounds, you'll develop your own pattern for listening, but you need to use the same pattern each. Mr. Banner, next we're going to assess your cardiovascular system. Do you have a history of heart problems? Any family history of heart problems? Do you ever suffer from chest pain or dizziness? Okay, I'm going to listen to your heart and assess the number of beats per minute. I'm listening for the rate, rhythm, and strength. When I listen for the pulse on the chest, I'm listening for the aortic, pulmonic, herbs, tricuspid, and mitral. I'm going to show you on our skeleton where you would listen for those. This is the aortic. This is the pulmonic. This is herbs. This is the tricuspid. And this is where you'll listen for mitral. Mr. Banner, I'm now going to assess your pulses. I'm going to assess all pulses bilaterally except the carotid. We're going to begin with the temporal, the carotid, and to assess the other carotid, you would walk around on the other side of your client. I am then going to go for brachial, radial, femoral, popliteal, posterior tibialis, and pedal pulse. The purpose of assessing pulses bilaterally is to ensure that they are equal and strong. After checking the dorsal pedal pulse, you want to check for redness, temperature of bilateral lower extremities. To assess this, you want to feel with the back of your hands. I'm going to go ahead and assess capillary refill of the toes. And while I'm down here, I'm going to check skin in between the toes. And of the foot. Okay, I'm going to check for edema by pressing in for 10 seconds over bony premises. And there is none. All right, Mr. Banner, I'm now going to come up to your belly. Change my gloves. For this, I'm going to lie you flat. Okay, Mr. Banner, now that we've got you laid down, I'm going to go ahead and look at your capillary refill in your fingers. And I'm looking at skin. Again, you would not reach over your patient, but walk around. Do you have any difficulty with swallowing, chewing, heartburn, constipation, or gas? Any tenderness in your abdomen, your belly area? How often do you have a bowel movement? Can you describe your stool? When was your last bowel movement? Okay, I'm going to look at your belly. I'm looking for any pulsation or distension. Okay, I'm now going to listen for bowel sounds in all 4 quadrants. We have the right upper quadrant, the left upper quadrant, left lower quadrant, right lower quadrant. I'm going to listen for 5 to 15 seconds in each quadrant. I'm now going to palpate. I'm going to palpate in 1/2 inch in small circular motion in a U pattern. If the abdomen was large, then I would use an S pattern. As I palpate, Mr. Banner, I need you to tell me if there's any tenderness. As I palpate, I'm feeling for any masses. And I'm observing his facial grimaces. Mr. Banner, do you have any problem with urination? Any pain or burning when you use the restroom? Do you wake often at night to urinate? Do you routinely use protection during sexual relations? If Mr. Banner was Mrs. Banner, I would ask her when her last menstrual period was, and if she had any problems with her menstrual period. Mr. Banner, do you have any history of STDs? If Mr. Banner had a catheter, at this time I would check the patency. Mr. Banner, we're going to go ahead and sit you back up, and I'm going to look at your musculoskeletal system. Before I do that, do you have any pain in any of your joints? Do you have any difficulties performing your daily tasks due to weakness or being tired? If Mr. Banner had told me he had pain in his joints, I would assess those joints last.